Major healthcare developments could be coming in 2024. For the first time in history, Big Pharma and Medicare officials will go toe-to-toe in negotiations to try lowering prescription drug prices. And the FDA could review certain psychedelic drugs for PTSD treatment. Our own Stephanie Haynes joins us live to explain. Stephanie, the best part of all of this is the idea that seniors could save on prescription drug medications eventually.
That is certainly the goal this morning, Nick, and these historic negotiations between these drug companies and Medicare officials are getting underway, and this is all part of the Inflation Reduction Act. The Biden administration has so far identified 10 Medicare Part D drugs that it wants to start off these negotiations with. You might be able to see them here on your screen. These are common prescriptions for blood clots, diabetes, arthritis, Crohn's disease, and more. And so these negotiations will take place over the next few months and will be kept under wraps until the final number they think is that maximum fair price that people should pay. That is set to be revealed by Medicare officials in September. However, the drug companies are suing to try to stop this process. So the soonest you might see those price reductions from these specific negotiations might not be until 2026. But next month, certain drug makers may have to pay a penalty if their prices went up faster than the rate of inflation. And those enrolled in Medicare on these close to 50 drugs could save up to more than $2,700 per average dose, according to the White House. And then also this year, we can expect the enthusiasm around psychedelic drugs to accelerate. You know, the first ever application seeking approval from the FDA for MDMA, that is commonly known as ecstasy, has been submitted. And researchers, medical workers want this to be used as a way to treat PTSD under the supervision of a doctor and with talk therapy. A therapist would likely be in the room when this would be administered. And both Democratic and Republican lawmakers have really expressed some support for this. So some medical workers are totally gung-ho, and others say not so fast.
Getting you out of these very dark places, lowering the central sensitization to pain, getting you sleeping better, taking the suicidality out of your mind, at that acute moment and making you open to therapy. We need the opportunity to look at those. We need the opportunity to study them.
More science is required. I want to make sure that everybody who feels that there's potential pursue that. And that goes back to the value of rewarding innovation. Relative to something happening in 2024, relative to an approved psychotropic drug coming on the market, I wouldn't bet my money on it.
MDMA is, like I said, known as ecstasy, was known as a party drug, is still considered a Schedule I drug according to the DEA, and that means that there's no accepted medical use, and it has this high risk potential for abuse, Nick. So we'll see how that plays out as the year goes on.
So more research, but in the end, seniors could possibly save money.
Exactly, Nick.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.